the APOLO study looked at using Atezolizumab as both as neoadjuvant, concurrent and adjuvant therapy around the use of definitive chemoradiation in patients with stage 3, now unresectable non-small cell lung cancer. And this is a little different because obviously we've moved away from giving neoadjuvant therapy in the stage 3 setting. We've tended to give either concurrent chemotherapy followed by adjuvant, whatever. So going back to neoadjuvant therapy seems a little bit like going back to the future, so to speak, and we'll talk about that a little later on too as well. But again, very good progression-free survival rates. One very interesting, again, there was very little uptick in radiation pneumonitis, which is a real concern, particularly when you're giving either neoadjuvant or adjuvant, and particularly when you're giving concurrent immunotherapy. One challenge about this study and the other abstracts in this session is that with PACIFIC-2, we are now questioning the value of concurrent immunotherapy alongside radiation, and whether this would be taken forward into proper phase 3 design remains to be seen. But again, it's not a promising strategy.